They've seen the horrors in person. MedGlobal has been on the ground in Gaza for months now, volunteering for medical missions to help those suffering within a dire humanitarian crisis. These doctors have had an up-close and personal experience with the bombs and the blasts destroying Gaza and killing innocent people as the war between Israel and Hamas rages on.
Dr. Zaher Sahloul is one of those doctors that spent a lot of time in Gaza treating those patients. He's also the president and co-founder of MedGlobal. Doctor, it's so great to have you with us. And we both have been going through the pictures and the videos that you yourself had taken. And I think the images that really struck us was when you and other doctors had to actually treat kids on the floor. Just describe the conditions that you saw and the challenges in that moment.
Thank you for having me. It's a horrible situation. I mean, we're running out of words to describe what's going on in Gaza. When I was in Rafah and Khan Yunis a couple of months ago, and this is my colleague, Dr. Tahir Ahmed, who's an emergency room physician, we've witnessed the impact of war on civilians and also how doctors and nurses, heroes, are dealing with these situation with very limited resources. So they're running out of medical supplies, of medicine, of painkillers, of antibiotics, even beds, hospital beds. So that's why when we had a mass casualty event like what you're seeing right now, patients are resuscitated on the floor. This child, Muhammad Khalil, is 12 years old. He was injured after a missile attack. He had shrapnels in his head and his belly. We had to intubate him, put him on life support, and the floor of the emergency room, like every other child who is injured. And we had to take him to surgery. He had abdominal surgery. He never woke up. We pronounced him dead. We could not communicate with his family to tell them that he's dead. I took a copy of his death certificate to make sure that people can have names and pictures behind the number that we're seeing. 14,000 children have been killed, which is 1 out of 100 children in Gaza, the equivalent of 500,000 American children. 5% of people in Gaza have been killed or injured so far. This is a catastrophe beyond description.
Doctor, that is utterly heartbreaking. And I'd like to ask you also about how your team is focused on what they call nutrition stabilization, right? The famine that's happening in Gaza. Tell us more about the program, about what you're seeing and how you try to save lives.
It's a very important question, Terry, because what's happening with severe malnutrition that Gaza did not witness over the past 16 years or so, despite of the shortages, is painful because these children will have irreversible impact on their physical and mental health and development for the rest of their lives. So what we're happening right now will affect generations to come. So we established 2 stabilization centers. We are providing a special formula for children with moderate and severe malnutrition. One of them is in Rafah. We had to close a couple of days ago because of the massacres that you have described. And we had to move it to Al-Mawasi, which is an area that is considered safer, although there is no place is safe. But what happens when you close a stabilization center for the treatment of malnutrition, that the children that you are treating are dispersed like everyone else. 900,000 people in Rafah have been displaced to middle area. So it's very difficult to find these children that we've been treating. That means some of them will die, unfortunately, because of infections. So that's why it's important not only to focus on the people who are killed, but the displacement. Many of these 900,000 people, which is close to half of the population of Gaza, have been displaced multiple times before they ended up in these areas right now that keeps shrinking.
So I think just seeing these pictures, hearing these stories, they're endless. I mean, what you're dealing with and what you're going through. And I know that since you've been back, you are now in Washington, D.C. for a briefing regarding what's happening there in Rafah. Can you tell us what you're trying to accomplish? Have you been able to meet with the right people? And then I also want to ask you about this letter from a member of your team that one of your doctors actually gave to President Biden. I understand this is an 8-year-old girl, now an orphan in Rafah. She wrote this letter hoping it would get to our president. Can you tell me what that letter said and how the president reacted?
We had the pleasure to meet with President Biden and also Vice President Harris a couple of months ago in the White House after we came back from Gaza. And we showed him pictures of the children that have been killed, the impact of the war on civilians. And this child's letter that she wrote to President Biden, asking him to help, to intervene, to stop the war, because she wants to be a doctor in the future. Every child I asked in Gaza, what would you like to be in the future? They said doctors. They want to help their communities. Gaza has one of the highest literacy rate in the region because of the work of organizations like UNRWA. President promised that he will do his best to stop the offensive or to protect the civilians and to intervene to prevent the offensive in Gaza. Unfortunately, what we're seeing right now in the last few weeks is the opposite what he has promised. I think every member of the Congress can help by helping evacuating patients who can be treated in the United States, by increasing aid to Gaza. We need 1,000 trucks, not only a couple of hundred trucks or 50 trucks trickling inside Gaza. And of course, stopping the war and making sure that Gaza is rebuilt, because right now, the majority of cities and neighborhoods in Gaza is unlivable. Khan Yunis, which we work, 75% of the buildings have been destroyed. The impact of this war on the population of Gaza and the region, and also our moral authority in the world, is beyond description.
Dr. Zaher Sahloul, we sure appreciate your time, what you are doing for those in Gaza, and we'll continue to follow your journey and everything you and all your fellow doctors are doing. We appreciate you.
Thank you.
Thank you.